Merci beaucoup. Alors, c'est un site
So this website was designed with the Digital University. It's a partnership. And we have a next session. And this will be, so we're going to scroll down. You have training along this page. You can click on any kind of training. So you have lots of speakers, lots of topics. Right at the bottom, if we go up, just go up a little, you have a little key. And this key contains the various trainings. And for caregivers who do not have access to this training, and maybe internet, in situ, or content to training. So let's click on one of the pictures. Mrs. Agnès Ordelero will see what's there. So the web user could go on diabetes.org because the website is open. So click on that link right below. Okay, the video is going to start. And no, it's not this one, sorry, says the speaker. Let's go on this video. So standard training, and then we have the PowerPoint right next to it. So either you want to listen to the speaker or at a later time when you have time. Or you can even download it on your USB stick, and you can also get training on the theme of diabetes. Can you tell us how it all started with this project? So, hello, I am Professor Kouassi. I'm the General Director of the INSP, which is here to train, to also carry out research. And so it's a great honor for me to show you the project of e-diabetes. Just a couple of words on the context. You know that diabetes is a major public health issue globally, but also mainly in Africa. The mortality rate is unfortunately still very high. In Ivory Coast, if you look at the population, estimated 24 million inhabitants, the International Diabetes Federation said that this disease had a prevalence of 4.94%, but also 62% of non-diagnosed cases. Now, in our institute, we have what we call a reference center that manages diabetes patients. There was a study carried out in 1971 and also tracked it till 2010. You see that there's a high boom of diabetes. The annual incidence is unfortunately multiplied by 5. As you can see, the first 10 years, on average, we had an additional 310 patients every year. Then the next 10-year chunk, 633. So multiplied by 2, then 1,049, multiplied by 3. And so recently, until 2010, 1,577. Today, we have on average 2,000 patients suffering from diabetes. Now, despite all the actions to try to reduce but also treat diabetes, the health authorities have unfortunately noticed that it is still on the increase. And there's also not enough specialists. We have about 15 diabetes experts in Ivory Coast, and we can talk about a limited knowledge, very restricted knowledge by the other health professionals on how you treat. Unfortunately, also the universities cannot, in fact, respond to what we call an emergency situation, how we build up the skills of the caregiver. So we believe that e-health, especially e-diabetes, is a wonderful opportunity, or not just an opportunity, a real need to reinforce on a short term term, not very costly, reinforcing the knowledge on this disease. So our project is the following. It is part of an international network set up in 2009, and initiative on hospitals in Geneva, French-speaking universities. Several countries have been part of this project, and look at the results, very interesting results. For example, our institute is a very recent player within this network, so we, in fact, are helped by the universities and also African training networks. What are the objectives of that project? On the one hand, we need to deploy ourselves in a very structured way, e-training. Similar training that we give in Abidjan, but also having a data center on diabetes in Ivory Coast. Now, since 2015, which was the kickoff of this project, we've had several things that were done. For example, we were able to record the classes, 25 to this day, but the idea of having continuing training sessions means that we can have 20 participants coming face-to-face classes, 50 online, but what's really original is the fact that we have invited special lecturers to exchange with the participants. So, to achieve our objectives, we still need to do other actions. For example, we need to decentralize the training sites because our institute has other sites, interconnection of the different centers, managing patients, use of medical devices that are connected to better, in fact, manage diabetes patients, and setting up a data center, and also increasing the awareness of health professionals, but also populations. So we hope that after that, the foundation, Pierre Fabre, will be part of our partners. Look at the logo. We have several partners, UNFM, then the African Network of Telemedicine, and the medical network, so that together we continue improving the health of our populations through this e-diabetes project. Thank you very much.
Merci. Merci, bravo.
Thank you.
Merci, bravo sur ce projet.
Thank you, and congratulations for the project. Other question, the objective is what? So people connect and train, but we also have group classes. Well, it would be a bit mix of both. The first objective, the INSP has a mission of training. And so on a regular basis, we have training courses on site, which is not always easy for caregivers because these are trainings in different cities. Now with e-health, it is important to attract new people, but also promote interactivity, exchanging with specialists, so that the treatment of this disease could be done in the best possible conditions. Yes, you've talked about the number of people attending the classes. Do you have also statistics on the number of treated patients? Was that the case? Were you able to treat patients that live in remote cities? Well, I spoke about initiatives. The first initiative was the specialized network, and that has been this case, and decentralization of this kind of management. So we do it with another lab, Sanofi, I can give the names. And today this management has definitely improved through this online training. And so several doctors are on spot, they regularly come on the website, exchange with our specialists and so on. One last question, this is a system that is well developed in Ivory Coast, but what is the future of these kinds of training? Do you want to put that in different countries or continents? Well, this training is already given in different countries, over 11 countries in Africa, French-speaking countries that regularly attend these online trainings. Now, of course, what we'd like to do today is not just have the training, but really improving the management of these patients with connected medical devices, but also having a database to have epidemiological data and start doing research.